Hello, my name is Mike Lesner. I am experiencing an amazing day today because I have come to the #1 medical tourism location in the world. Is it New York? No. Is it Chicago? No. Is it Los Angeles? Those are very fine systems in those fine cities, but they're not #1. I'm here to show you the #1 medical tourism destination in the world. Welcome to Bangkok, Thailand. Our American dream promises a long and healthy retirement. But for millions of Americans, especially over 50, that dream is overshadowed by a nightmare. It's called healthcare costs. An elective surgery, unnecessary cancer treatment, a joint replacement. These aren't just medical decisions we have to make. They could spell financial ruin for all of us. For Americans over age 50, particularly those of us relying on Medicare or supplemental policies, the choice of care may no longer be a simple transaction. It can be an ordeal that includes rising co-pays, shrinking networks, and the relentless complexity of the U.S. system. These often mean access to critical, high-quality care can be delayed or even completely denied. But there is a growing, exceptional, and surprisingly affordable alternative for people everywhere. It's called medical tourism. In a world of medical possibilities around the globe, nations are opening their doors to patients seeking better care. But more and more Americans are turning to Thailand. Thailand, why? This is a place where advanced medicine meets genuine human warmth. Here we should explore the expertise, technology, and heartfelt Thai hospitality that is redefining what exceptional healthcare feels like. At the heart of it all will be Bangkok Hospital. Hello, Dr. J.
Good morning, Michael.
I've heard so much about you. It's a great pleasure to meet you.
Pleasure to meet you as well.
I guess we're going to have a little quick chat about the fears that seniors, I'm a senior too, that we have about medical bureaucracy and how you navigate the waters to get the help you need as a senior. Can you comment for me a little bit on what your approach is?
Well, the first thing that comes to mind for anyone who would consider a hospital halfway around the world, of course, is the standard of care. Can we truly deliver the same level of care they would get back home? Speaking about, when people ask me about standard of care, I always say, it's not only about the facilities or the technology, it's about outcomes combined with how we care for people. At Bangkok International Hospital or Bangkok Hospital headquarters, we welcome over 300,000 international patients from over 160 countries. Our doctors were internationally trained. Several of them were trained in the US or UK.
Yeah.
And these folks, they bring back expertise, knowledge, and medical technologies back home.
And how do you approach language sensitivity?
Of course, all of our doctors speak English. But we do have international medical service with the interpreter service that can...
For 20 different languages, I hear.
We do. Actually, both on-site, both online. We do have that kind of help for patients from any countries.
Yeah. Mm-hmm. Seniors are funny beasts. They don't need information overload. Mm-hmm. First, they need to understand you, understand your science. And second, they need to like and especially trust you.
Of course,
And
definitely.
from there, the world is at your feet.
Right, right.
Okay.
And speaking about international standards, as an American board certified doctor myself, I strongly believe that our technology and treatment methods are on par with leading hospitals around the world, including the United States.
Oh, sure.
For example, we use the latest possible diagnostic imaging, the minimally invasive surgical techniques, the advanced therapy, and often these equipments, we find the same equipment and protocols that you would find in the top US centers.
And you ought to know because you trained there.
I would like to say so, yes. Yeah, well, one more thing I want to point out is that our uniqueness is we blend the Western technology with Thai hospitality. It's all about how we deliver the care. You know, you get the same level of care, same kind of care anywhere, but it's how you get the care from us. As people would say, you know, the journey is as important as the destination. So we don't only aim for the best clinical outcomes, but we also want to make the patient experience as pleasant as possible. And we want to make them feel it the moment they walk into the hospital.
Well, they will be deeply appreciative of both. Well, it's remarkable, and I'm very excited to learn more, and thank you for sharing that
Of course.
with me. I will remember this always.
Thank you.
All right, you've convinced me that best medicine is alive and well here. I have a couple of other questions, however. I'm an American. I'm a foreigner. I'll take my own case. How does this process begin for me? For example, am I able to get pre-clearance? What can I expect about the approval process? Will it be drawn out? Is it quick? These are all questions that are just as critical as my health questions, and I'm going to assume you have some good answers for me. Hello, I'm with Dr. Evelyn. What an interesting story she has. She's originally from New York, but I believe at 8 years she left, and she went off on her career to become an allergist, but she also pilots the insurance for international admissions. And to someone who's come to a foreign country, particularly from the United States, on a 22-hour plane ride, they have many questions. Among those are, how am I going to pay for this? And good or bad, if I can learn it, I'll feel relieved. So with that, Dr. Evelyn, welcome to the show. You've got the floor.
Oh, thank you for having me today. So here at Bangkok Hospital headquarters, we work closely with over 150 international insurance and assistance companies worldwide. So we even have a dedicated department, the International Insurance Department, who is here to help guide patients step by step from the beginning to the end. So our insurance coordinators, they are dedicated, they work 24/7 to help guide patients throughout the process, starting from coverage verification. They submit the pre-authorization request. They help patients gather all the necessary documents, like the medical reports, the claim forms, the treatment codes, the receipts. They do claim submissions, and we even have a team of doctors and nurses who will coordinate directly with the insurance medical team.
Bangkok Hospital. It's world-class medicine, but it's also affordable, it's accessible, and delivers world-class care. We're here with Dr. Raman, and we're going to talk to him about this really unique and interesting and a very important role that he performs within this Bangkok Hospital system. Number one, let's talk about quality care, international medical services, Raman.
We provide, a place for a first point of contact for international patients. So our doctors here speak English. We have interpreter services available on site here, and our staff here are used to looking after international patients. So the whole design of this department is this first point of contact where patients come, and invariably most patients would also want to do some form of health screening before as well. They may have existing problems already, or they may have none, but just coming in for just a doctor consultation and a checkup, that will be handled here as well. And after the process is complete here, then we will also handle further referrals if need be. It's a huge hospital, lots of specialists, lots of departments. So we will help to even select doctors for patients based on our experiences. And our department here will then help make the appointments and then arrange, facilitate the consultations with other doctors as well. But in addition to that, because we were the initial point of contact and we have the initial rapport with patients, our doors are open as well. At any time or any stage of a patient's visit to this hospital, that they're more than welcome to come back.
We're here at Bangkok Hospital where every story begins. We have centers for excellence for cancer, for cardiac care, for neurology.
Yes, the top three is about the first one is coronary heart disease. That is a person with acute heart attack or cortical syndrome. The second one is about the arrhythmia, so-called atrial fibrillation, that is most common in the elderly. And the third one is about the heart failure. We are the first private heart hospital in Thailand, and we have facility in all aspects of heart disease. So when the people come into our hospital, we take care from the early detection, treatment, definite treatment, and prevention, and we follow up all the time.
Let's learn about some of these journeys. Let's go on one ourselves and find out exactly what plays into having the perfect cancer treatment experience, including your travel.
Why we build a very healing environment for the cancer patient to have the good journey. So here we have the concept. So you can see this is like the airplane. So they come to our day chemotherapy. When patients talk about chemotherapy, they were scared of the
Wouldn't
side
you
effect.
be?
Yeah.
Oh, amazing.
And here, our vision, I would like our hospital to be the value-based cancer care in Asia Pacific. Here we have the 4 pillars of treatment here
Yes.
already, like the surgery, chemotherapy, radiation therapy, and also immunotherapy. For surgery is the most important modality for treatment of cancer, but we must have the very localized or the early stage.
Yes.
So here we also have the cancer early detection program here also. So the percentage of the surgery and successful it depend on the stage of the disease.
Yeah.
But in the early stage, like the breast cancer in our institute, more than 95% can alive more than 5 years.
This hospital, in every one of its major divisions, approaches medicine in exactly the way that you would want to be treated. The best science, the smartest people, intelligent experimentation, ears always open to next technology, and the Thai people are amazing people in terms of their ability to relate and be comfortable with seniors. Seniors love that.
Now we are under construction of the new machine for the radiotherapy. We call the proton therapy. It will we can open in the 3 years later. Now it's under reconstruction of our building and installation of a machine here in Bangkok Hospital.
Neurotreatment, neurodiagnostics, neuroanalysis. The words alone conjure up images that this must be someone who's very, very well trained in this kind of science. To get the answer to these and many other questions we have about neuroscience, it's best to speak with the experts.
Very nice to meet you. Welcome to the Neuroscience Center.
Thank you. I want to learn everything I can about all this great work you guys are doing here.
Sure. Let me show you around, please. On this particular floor, we have two things. One is the operating room on the right of us, and on the left, we have 3 neuro ICUs. So this is one of them. Each has about 13 beds, something like that.
Wow.
So in total, we can handle around 40, 50 patients in our ICU. In terms of the seniors, I think the common diseases that bring them to the hospital is, well, number one is probably stroke. This is kind of worldwide problem. Number 2 is probably memory problems like dementia, Alzheimer's, that sort of stuff. And number 3 is some movement disorders, for example, Parkinson's disease. So this is the major diseases that we deal with. So in terms of the treatment protocol, we are certified by JCI for quite a few categories of these, especially stroke. We have been certified by JCI for many, many years.
So Dr. Chakoen, welcome to the show. Thank you for welcoming me to the hospital.
Thank you. So, as I did my training in the United States, and I'm a American board certified neurologist, I can say that at the Neuroscience Center of Bangkok International Hospital, we are on par with the most of the major US neuroscience centers. We have all neurological subspecialties in our center, and we can perform almost all major neurological investigations and treatment here. Can do for example, for the diagnostic part, we can do the MRI, detailed MRI, PET scan for the diagnosis in all the blood-based biomarkers for Alzheimer's disease. We can perform evaluation for epilepsy surgery, can do continuous long-term video EEG monitoring, and we have done epilepsy surgeries here. For Parkinson's disease, we can perform the deep brain stimulation.
Impressive.
You have done several cases.
Wow. That's top tier.
Correct. And we even have the collaboration to Mayo Clinic in Rochester, Minnesota, so that in complex case that we don't have an answer, we can send the test to them, and then we get the results back.
Mayo has been profiled in many, many things we've shot.
Yes.
And if you are aligned with the standard of care and exceed that, you've done very well.
Thank you.
I want you to think of a story that is the perfect example of the magic of proper diagnostics.
I think there's a case that come into my mind. So he's not actually coming from abroad just for diagnostic, but he's an expat here. So he came in, he was admitted for severe back pain and leg weakness. So he was admitted for pain control for that. But the next day, he just suddenly turned comatose and had developed the seizures. So that's why I got involved. And we found that the patient did have the toxin from the bacteria that he got about a week ago. He got diarrhea. And it's result from one of the bacteria called E. coli, and that bacteria produced the toxin. and caused hemolytic uremic syndrome, which is the syndrome that damage your blood cells and also the kidneys. So he got into acute kidney failure requiring hemodialysis. He need the plasma exchange to get rid of the toxins of the blood. He get actually multi-organ failure. His liver has the problem.
Oh my.
The blood itself is the problem. The brain become comatose. The kidney also the problems. So when the patient has a lot of problems, system failure, his mortality rate was estimated at around like 80%. But with the help of my colleagues in hematology, in nephrology, infectious diseases, the critical care team, we are able to help him. And now he's fine. He's independent. He's back to walk again.
Actually, in that kind of a rehab, he's more resilient than he was before his first episode.
Yes, indeed.
Wow, congratulations.
Thank you.
Great job. I know that's just one example of all the things that you're doing here that are so remarkable. But thank you for doing it. And thank you for telling us that story. That story will be meaningful to people in America. Good work.
Thank you.
Made the decision to come to the best medical resource in the whole world. You've seen that. You have seen the wonderful Thai people, but there's more to the story, because many people come out and they want to come to a place like this to just relax, chill out, be comfortable. But there would be a requirement for such a place. Am I close to medical services? This is that place. We are here in Hua Hin. Imagine you're here. We're here in what only could be described as paradise. Something you didn't expect. Does that destroy paradise? No, because where you are is Bangkok Hospital, Hua Hin.
Sawasdee krab. Hi, good morning. Welcome to Bangkok Hospital, Hua Hin. Certainly, as you can see, that the population here, I would say probably half of the population here are retirees, and a lot of them are from the States, from the UK, from Scandinavia, from Germany, France, and of course we have local Thais living here as well. This year is a great year that we expanding the hospital, to another phase. Like this room is in what we call Ward 4B, which is located in the new building that we're going to open for the full service by Q1 of next year in 2026. I would say that Bangkok Hospital Hua Hin is not going to be as big as the headquarters in Bangkok, but it's going to be a boutique health retreat hospital that belongs to BDMS, which is our healthcare network, focusing on serving the community both in Hua Hin itself and the surroundings. Let's say if people want to travel to the southern of Thailand, in terms of healthcare, they would think of Bangkok Hospital Hua Hin first. I want the environment here to be as close as their home as possible. They can trust in our doctors, our nurses, our facilities, the safety of the hospital and the care that we provide.
Well, thank you. And I assume maybe we're going to take a look at some things?
Absolutely, sure.